for today po, like what I've said po sa group, no, today we're going to discuss about feeding. So for those parents po or teachers who's handling kids na may feeding issues, pwede po ito, malaki po yung may help nitong lecture na to para mas maintindihan nyo po sila. Also, we'll be trying to talk about yung mga basic na strategies na pwede nating gawin. So for today po, our topic is feeding, and mostly we're going to focus more on the SOS approach po. So let's start. Alright, so for today, our topic is feeding, and the title po is Let's Play to Eat. Alright, dun po sa bago sa group, again, my name is April Lu Magnaye. I'm an occupational therapist. So before we start, let's talk about the importance of mealtime experience. Actually, for us OTs, feeding or eating is not just about taking in nutrients. Hindi lang po ito para maging para kumain o para maging healthy yung mga anak natin, but we're talking about different things as well. So the first importance is more of physical growth at saka health. This is what I mentioned po kanina, no? So we eat para mag-take in ng nutrients, okay? So our kids need this to grow and be healthy. Next is sensory exploration. Another reason for this, yung importance po ng mealtime is it provides different sensory information to our kids. 'Di ba pag kumakain, nagwo-work yung lahat ng senses natin. Yung sense of sight, pagkakita pa lang sa food, sense of taste, andyan din po yung smell, also the texture for the sense of touch. So iba-iba po talaga yung sensory systems na nagwo-work. That's why also when eating is involved, nagagamit po nung anak natin yung kamay niya, yung arms niya, or even yung whole body niya to be able to eat. Next is communication and socialization. So feeding also provides a way for our kids to develop these two areas. Okay, bakit po communication and socialization? Because for us, eating is a highly social activity. No, expected po bilang sa atin, 'di ba? As a family, expected na we eat together. So sama-sama yung buong pamilya. So during eating, we're able to communicate to each other, we're able to talk about different things. So if kunyari expose po yung bata or yung anak natin sa ganitong setup, then we are able to encourage them to talk or communicate or socialize as well. Also, through feeding, we're able to share familiar and personal values. So, as parents, minsan habang nasa hapagkainan, nagagamit po natin yung venue para turuan or paalalahanan yung mga anak natin about different things that we want to teach them. Tama po ba? So, that's why we're able to share mga different values na gusto nating matutunan nila. Also, it provides a sense of community, a sense of family and culture. So, these are some of the importance of eating or mealtime experience. Now, after that, we also have to talk about mealtime influences. Ano po ba yung mga nakaka-affect sa pagkain ng ating mga anak? So, the first one is culture and beliefs. So, kanya-kanya po tayo ng paniniwala tungkol sa pagkain or yung way of eating. 'Di ba sa atin may iba-ibang for example, based sa religion, may pagkain tayo na hindi dapat kainin, or some families they raise their child to be, for example, a vegan or a vegetarian. So, iba-iba po yung culture na nakaka-affect sa pagkain ng mga anak natin. Aside from that, there's family dynamics. For example po, here, iba-iba rin kasi yung setup natin at home. Minsan, tayo lang sa bahay. Minsan, mayroong extended family. or kasama ang tito, tita, lolo, lola. So, iba-iba po yung dynamics nun. Now, if for example, magkakaroon kunyari ng misunderstandings or conflicts while eating, habang kumakain, may disagreement, then possible po kasi na it may strain yung feeding behavior ng bata. The kid might respond with like physical and emotional tension at nawawalan siya ng or nababawasan yung ability niya to eat well. After that, we also have child's health. So this is another thing. So another influence na nakaka-affect sa participation ng anak natin sa feeding. Why? It plays a major role in feeding because depende po if our child is feeling well or is okay kung paano siya magpa-participate. If, for example, your kid is well, then most probably less stressful for him yung eating. But if, for example naman, yung bata is suffering from, kunyari po, an acute medical condition. Kunyari, yung baby natin nagngingipin or kaya mayroong ear infection, may ubo at sipon or kaya po tawag dito, may flu, intestinal flu, then it will affect yung participation niya sa feeding during that time na may sakit siya. Aside from that, if yan po ay acute. But if, for example, it's a chronic condition, kunyari yung kid, yung baby sa premature siya nung ipinanganak, or meron siyang Down syndrome, or like kunyari po meron din siyang yung bata ay may cerebral palsy, so it will affect yung eating pattern niya or yung feeding behavior niya for an extended period of time. So those are the things na nakaka-affect. Aside from that, if for example then nagsasuffer yung anak natin sa gastroesophageal reflux po, no, yung parang meron silang bad experience sa pagkain, na-chuchok, na-aspirate, then it will affect also yung feeding behavior. Ma-associate po kasi nila yung feeding experience na negative dun sa pagkain. Kaya the next time you present a food, possible na mag-avoid siya or kaya meron ng negative reaction like iiyak or mag-struggle. Aside from that, we also have child's developmental skills and needs. So here naman po, tinitingnan natin ano ba yung ability ng anak natin. At par po ba or well-developed po yung mga fine motor or gross motor skills ng anak natin. So if merong problem with fine motor skills or gross motor skills, then possible na ma-affect din po yung performance niya during feeding. For example, if fine motor skills is not well, hirap siya to manipulate, for example, the food, hindi niya mahawakan or makuha, or hindi siya makagamit ng utensils. So those things are some of the examples lang. Aside from that din po, eating po kasi or using the mouth is fine motor skills, considered a fine motor skill. So if he has problem, if this kid has problem with fine motor skills in general, then possible na yung muscles involved sa pag-chew, pag-swallow, affected din. So that's how it affects the child's feeding skills and behavior. Next is the child and the parent's emotional state and temperament. So it affects also how the child is behaving. For example, the child is shy or like may mga sensory issues siya. So kunyari, very cautious siya, hindi siya masyadong nagtatry ng mga bagong pagkain or matatakutin or like umiiwa siya if you're presenting something new. Then that will affect yung variety ng food na ititake niya or tatanggapin niya. Also, the parent's emotional state and temperament. So, I understand kasi pag ganito ang problem, if you're a parent and your child is, kunyari, nagsasuffer sa feeding problem, kayo as a mom, mafu-frustrate kayo or medyo masasad, like malulungkot kasi 'di ba parang you're thinking baka hindi na siya kumain or like hindi niya nakukuha yung tamang nutritional yung intake na dapat meron siya. So those things are yung mga things na winu-worry natin as parents. So it will affect also how you're going to treat the kid during feeding. So if you're frustrated, if you're easily irritated, so minsan nagkakaroon ng struggle during feeding, ang ending is nagkakaroon lang ng kunyari napapagalitan yung bata, or si mommy or si daddy na nagagalit na din kasi ayaw kumain ng anak. So those things are just some of the influences during mealtime. Now let's move on to the feeding issues na. Okay pa ba tayo? Mommies, teachers, okay naman po. Mabilis po bang masyado?
Sakto lang, teacher.
Sakto lang, oo. Kasi medyo pahapyaw na lang yung start because I want to focus more on yung talagang kailangan nating ipag-usapan. So now we're moving to feeding issues. What are the warning signs? All right, if you're a parent and you're thinking na is my child okay? Okay pa ba yung anak ko? Hindi pa ba ako dapat mag-worry? These are the warning signs that you should take note. Before we move on, I think we need to talk about these two parang terms the picky eater and the problem feeders. So ito siguro later we'll try to see while we're discussing it, you try to think about your kid if you have one or your child na hinahandle nyo in school, and then we'll see if that kid is a picky eater or a problem feeder. So let's talk about this. Let's compare. All right. If your kid, here is like a comparison of the picky eater and the problem feeder. Here, if we're talking about the number of food types na he's accepting, for a picky eater, actually madami pa naman more than 30 food. So if more than 30 food yung ina-accept nung anak nyo or nung estudyante nyo, then possible picky eater yan. But if your child has like less than 20 food, then problem feeder na yan. Okay? So let's see, parang just think about your child and let's check kung saang category siya na bibilang. Next, reacquisition of lost food. So reacquisition means if, for example, due to burnout, nasawa yung bata, hindi niya na kinakain yung dati niyang kinakain. For a picky eater, after 2 weeks of rest, okay, nare-regain po niya yung food, bumabalik, kakainin niya ulit. Alright? But for a problem feeder, hindi na po nare-reacquired. Okay? Pag nawala na po yung food na yon dun sa list nyo, hindi na siya bumabalik. Na burnout na po siya totally. So that's for the problem feeder. Next, yung tolerance to new food. So this is very important. For a picky eater, he's able to tolerate new food on the plate. And usually, kaya niya po siyang i-touch or i-taste. Kahit ayaw niya, napipilit pa din naman. But for a problem feeder, aversion to new food, yun po yung pinaka-sign na makikita nyo. Even the sight, hindi niya kayang matolerate. Alright? So, ibig sabihin po nyon, kahit makita niya lang yung pagkain, meron ng aversion na makikita or may responses na, like for example, nasusuka, naduduwal, umiiyak, okay, or tumatakbo palayo. So, those are the signs na parang hindi niya matolerate even the sight or yung presence of food. Next, the type of food group or food nutrition group. So, for a picky eater, later on kasi, we divided the food group into 4. For SOS, later I'll discuss the SOS, we only have 4 groups. Meron po tayong protein, meron tayong carbohydrate, meron din tayong fruits and vegetables. So, yun po yung food groups natin. Now, for a kid that is a picky eater, the kid can eat at least 1 food for each nutrition group. So, kompleto pa naman po. Meron siyang fruit, may veggies, may protein, may carbohydrate. But for a problem feeder, they avoid the entire nutrition or texture group. So, possible po nun, kahit anong klase ng vegetable, ayaw niya. Kahit anong klase ng fruit, ayaw niya. Or like, nag-stick lang tayo sa protein, kumakain lang siya, for example, ng chicken. So, yun lang yung kinakain niya. So, that kid can be like a problem feeder already. Next, yung is in transition to new food in steps to eating. So, here we're talking about the steps to eating. Later on po, i-discuss ko sa inyo yan. So, for a picky eater, sa SOS po kasi, maraming steps for a kid to be able to eat. Ang step po na yon, 32 steps all in all. Now, for a picky eater po, kaya niyang mag-accept ng food after 15 to 25 steps. Alright? So, later on, babalikan po natin yan. For a picky eater, it's 15 to 25 steps. But for a problem feeder, bago po siya mag-accept ng bago na food, it takes him around 25 or more steps. Mas matagal po siya mag-accept ng bagong food. Now, in terms of the mealtime setting, for a picky eater, actually, ito po, kaya niyang kumain together with the family. Isang table lang. Pero possible na iba yung food niya. Okay po? So, hindi niya kakainin kung ano yung nasa table ng family. May sarili siyang pagkain, pero willing siya to eat together with the family. But for a problem feeder, they eat alone. Kasi the problem is, hindi nga niya po matolerate yung presence ng food sa table. So if it's something na hindi siya comfortable, may tendency siya to move away or to tawag dito, to avoid the situation. So most of the time, what happens is kumakain siyang mag-isa. Ang kinakain niya is yung food na kaya niya lang i-tolerate, but not really the food that the family prepared. Okay? So that's picky eater and problem feeder. Now going back, let's move on po din sa pinag-uusapan natin kanina na feeding issues. What are the warning signs? So here, the first is the child's health. Next, developmental food continuum. And then we're going to consider also the mealtime setting. Let's start first with the child's health. Okay? When we're talking about the child's health, nito pa po para parents.
Yes po, teacher.
Ayan, okay, sorry. Nagulat ako kasi yung isa kong dito, wala na daw time limit eh. But, andito pa naman tayo. So, i-continue ko po Sorry, bigla akong nagulat. Andito pa naman tayo, no?
Yes po, nandito
pa
po.
naman. Sorry. Teacher Lee, if ever makat,
Yes,
you text me agad, ha?
Okay po, sige po.
Sige. Wait, asa na ulit tayo? Alright. So, we stopped here. So, child's health. Continuous yung weight loss. Alright? Even if he is eating, patuloy pa rin po yung pagbaba ng timbang. Alright? That's a warning sign. Next. Continuous yung choking, yung gagging, yung coughing during meal. So, these signs, nahihirapan pa rin siyang i-tolerate yung food. That's why may mga gantong reaction, choking, gagging, coughing. Also, there are more than one incident of gastronasal reflux. Alright? So, parang bumabalik yung food out sa mouth or sa nose. And then, there's history of traumatic choking incident. Alright? And respiratory problems. So, those are the warning signs. And then, sa developmental food continuum naman po, if we're talking about infants, at age 10 months, hindi pa po siya nag-a-accept ng food purees. Ibig sabihin, milk pa lang po siya. Remember po, when we have a baby, no? Usually po kasi, at around mga age 6 or 7 months, pwede na tayo mag-introduce ng food na pwede yung consistency is mashed or like blended. But for some kids, for some babies, hindi po nila ma-tolerate yun at 10 months. Also, at 12 months, hindi pa rin po sila makapag-tolerate ng table food solids. Here kasi pwede na po tayong mag-introduce ng mga rice. For example, na konting mashed, if hindi talaga kaya pa na parang the usual na presentation ng rice, pwedeng may sabaw. So he can tolerate, the kid should be able to tolerate those already. But if at 12 months wala pang solid foods, then that's another warning sign. At 16 months of age, hindi pa rin niya kayang mag-drink from a cup. And also, at 16 months, baby food pa rin tayo. Then that's another thing that we have to parang medyo mag-worry na tayo. Yun pa lang yung kaya niyang i-accept at 16 months, like Cerelac pa lang, ganun sa consistency or blended food at 16 months, then ayan, we should do something about it already. So, let's see. Also, during mealtime setting, yung anak natin, madalas nag-iiyak. Alright? Pagkakain, umiiyak. The family is fighting about food already. So, nagkakaroon na ng disagreement the parents kasi hindi nila mapakain yung anak nila. Nagtatalo na sila what food to prepare or kailangan ba na yung child nasa table or hayaang tumakbo or hayaang manood habang kumakain. Those things are some of the conflicts na parang issue na pinag-uusapan madalas or pinag-aawayan. Again, everyone responsible for feeding the child has difficult time. So, hindi talaga siya mapakain. Mahirap pakainin. And then the parent, they have history of an eating disorder. So, here we're talking about the parents na. Kasi if the parent has an eating disorder, then they may not be a good role model for the kid. So if, for example, you don't expect a kid or a baby to eat vegetables if the parents are not eating vegetables. So kung hindi siya exposed to eating or hindi masyadong kumakain ng vegetables at home, then hindi siya masasanay to eat it. So those things are some of the things na kailangan nating i-take note. Now, moving on, we're going to talk about SOS approach. So, ito na po yung I personally use in the clinic when I have kid for feeding evaluation or feeding assessment or feeding intervention. So, what I use is this particular approach, SOS. So, what this SOS means? So, SOS, S stands for sensory, and then O stands for oral, another S stands for sequential. Alright? Sequential meaning to say developmental po siya, yung approach. So, what are the main principles of SOS? When we're talking about SOS po, it's a transdisciplinary thing. So, meaning to say, me as an OT working, for example, with a nutritionist, with the speech pathologist, with his PT, if my PT if the kid is attending PT, pwede rin po kasama yung developmental pedia. So, it's a team effort kumbaga. Here po kasi ang perspective natin is we just don't focus on sensory. So even if sensory is nasa name mismo ng approach, we don't address the factors, this factor only. So SOS approach is a whole child perspective. Kumbaga, we take into consideration yung sensory, yung motor, oral motor, yung behavior, yung learning, lahat po yan. Even the medical condition and then yung nutritional requirements ng kid. So, we take this into consideration during assessment and then during intervention. Alright. So, ang mangyayari po dito, we also utilize, sabi nga, sequential. So, developmental po yung approach natin. Isa-isa natin ita-target yung bawat developmental steps na kailangan ng bata for him or for her to be able to eat. Hindi po na, it's not like, for example, ang goal ni parent is mapakain yung anak niya ng rice. Kasi ito usually yung goal pag may mga kids po ako in the clinic. Teacher, gusto kong kumain ng rice yung anak ko. So, for us, as SOS OT na nagpa-practice under SOS, hindi po namin ito target na kumain yung anak ng rice agad. We are going to look into yung mga factors why this kid is having a hard time eating rice. We're going to look into the sensory part, the motor part. So ano po ba ito? May tactile issues ba siya? Hindi niya ba ma-tolerate yung rice? Or may motor issues ba siya? Hindi niya kayang hindi nag-work yung muscles niya in the mouth well para ma-manipulate yung rice in the mouth? So may motor planning issues ba siya? Or even gross motor skills, like is he able to sit upright? Baka nahihirapan pa siya with gross motor. That's why we have to address it also. So those things, we have to consider everything. Now, when did it start? The SOS started actually more than 20 years ago by Dr. K. Toomey. So siya yung proponent ng SOS. All right, let's move on. Again, moving on, SOS is like a systematic desensitization, alright? So, ibig sabihin po nito, iisa-isahin natin yung steps to eating. Later on, mas maiintindihan natin ito as we go along. And then, food hierarchies. So, sa food, we have food groups. Tulad ng nabanggit ko kanina, we're going to consider protein, carbohydrate, food, fruits, and vegetable. And then, with SOS, family involvement and collaboration is very important. So, as much as possible, tinatry namin na parang i-involve the parents. Kasi during the session, we try to teach them how to facilitate the kunyari, mini feeding or eating session and how they're going to carry it over sa bahay. So let's move on. This one's very specific na. This is what I'm talking about kanina. Systematic desensitization. Here, we progressed through multiple steps of eating. So, beginning with the easiest po is tolerance. So, tolerance ng particular food hanggang eventually pumayag na siya to eat it. Alright? So, actual consumption, actual eating. So, the steps po includes tolerance or tolerates, then interacts with or touches, then we smell, and then after that, taste, and then eat. So, mag-start po tayo sa pinakamababa. And yung pinakamababa is the child able to tolerate the food? Yung first po nun, tingnan natin, is the child able to tolerate the food in the room? So, if for example, yung anak nyo po, hindi niya kayang ma-tolerate even yung presence pa lang ng pagkain sa room, na nagre-react na po siya, makita niya lang yung food sa table, like lalayo na siya, mag-iiyak na siya, or magka-cry, then hindi po tayo mag-move muna. We have to work on this part first. So, tolerance of your kid sa food in the room. When he's able to tolerate it, wala na pong negative reaction, then we move to food on the table away from him or her. So, kunyari po, nakaupo siya, pero yung food niya nasa table, malayo sa kanya. Pag kaya niya pong i-tolerate to, we move up. The next is tolerate the food on the table in front of him. So, sa harap na po niya mismo, dito po kasi wala pang demand for him to eat. It's just the tolerance of the food. Okay? So, if he is able to tolerate the food in front of him, we move up. Kaya niya po bang i-tolerate yung food niya on his plate? Okay? Dun sa plate na ginagamit po niya usually to eat, kaya niya po bang i-tolerate if that food is on the plate? Alright? So, that one, when he's able to do it, then we move up. After tolerance, we go to interacts with or touches. So, here, Nakikita niyo po yung progression, di ba? From the easiest, pataas ng pataas yung demand. So, interacts with yung pinakamadali is to touch the food with napkin, utensil, or other food. Okay? So, ang gagawin niyo po, nasa plate niya yung pagkain, hindi niya pa kayang hawakan. So, you're going to use other objects like, kunyari, kutsara or tinidor or napkin para ma-manipulate po niya yung pagkain. After that, if he's able to do that, hindi na po siya nasusuka or naduduwal or hindi siya nagpapakita ng negative reaction, we move up. You allow him to touch the food with one finger. Kunyari, isa lang muna. Pag kaya niya na po yun, then we move on to touching the food with 2 fingers or more. So, if he is able to tolerate this, no reaction at all, pumapayag naman, let's move up to touching the food with whole hand. Alright? And then after that, pwede nyo na po siyang i-challenge to pick the food, to wave, to tap it, to manipulate it. So, hawak na po niya talaga yon using both of his hands. Now, after interaction, we move up. If okay na siya with interaction, we go up to, I'm sorry, I forgot the food on the hands, arms, and shoulders. Alright? As you can see here, yung tolerance niya would be from distal to proximal. Ibig sabihin niya po doon, sa pinakadulo, palapit sa katawan. That's why you start with the arm, with the hand, and then go to your arm, go to his arm, and then sa shoulder, papalapit sa face. So, here po, pwede kunyari na matouch niya or i-touch siya nung food dun sa different parts of the body from distal to proximal yung direction. After interaction, right, yeah, there, you put the food on the head, on the neck, or the ears. Yun yung pinaka-last part of interaction. Next, we go to smelling. So with smelling, is the child able to bring the food liquid or close proximity to the nose or the mouth. So, ibig sabihin, kaya niya po bang ilapit yung pagkain sa face niya or sa nose niya para amuyin? Pwede niyang gawin is amuyin to or to blow or like to blow bubbles in it. So, yun yung mga pwedeng activities using this steps to eating. Next, can he put the food on his chin? Kaya niya na bang ilapit yung food sa chin niya, sa cheek niya, or sa nose? So, if he can do it, we move up. The next level is the taste. Okay? Ito po, tasting lang po ito, hindi pa pagkain. So, what is he going to do? First, you ask him to touch the food with the lips. Parang, ang term po namin ito sa clinic, can you kiss this? So, pag yung kissing part, kiss lang po talaga. Touch ng food sa lips. So, if he can do it, then we can move to lick the lip. So, for example, kung ano po yung pinang-kiss niya, itatry niyang i-taste. Okay? So, that way, parang matlalasahan niya na yung pagkain, but not really eating it. Next po is hold the food in the lips. So, ibig sabihin, iipit niya lang po sa lips niya yung pagkain. If he is able to lick it, now, itatry niya po siyang i-challenge to hold the food in the lips. And then, like, kunyari po yung nasa picture, parang ganyan. But not ganyan ka exaggerated. Kaya konti lang po. Kasi that one, hindi nila yan kaya. So, isang peraso ng, kunyari, ng french fries, i-hold na between the lips. O, yun na po yun. Then after that, tap the food on the teeth. Sa teeth naman tayo, papasok tayo ng papasok. And then after that, you touch the food with the tip of the tongue. So those things are some of the, like, pwedeng isa-isahin nating ipapagawa and then hold the food in the mouth. So holding the food in the mouth means it's just there. Nasa loob lang ng mouth, pero not really prompting him to eat it or swallow it. So, sa clinic po, what we do is, kunyari, sasabihin namin sa kid, okay, can you hold this or put this in your mouth for 5 counts? So, parang, for example, we ask him to put, kunyari, a marshmallow in the mouth. So, we'll ask him to put it in the mouth, and then after 5 counts, we allow the kid to spit the food out. So, pag SOS po, yung spitting is the normal part of yung routine nila. Okay? If they cannot tolerate it, if they cannot Like for example, keep it in the mouth for that long, they are free to spit it out. So yung spitting po kasi, it's like a very crucial part of SOS kasi it will encourage the kid to participate more kasi andun yung option nila to not to go forward if hindi nila kaya. So, yung lead po nila, yung ifo-follow natin, if they cannot tolerate it yet, if they can't chew it or swallow it, they can spit it out. Next, ito po yung pinaka like nasa taas nung steps to eating natin, pinaka mataas na demand is to eat it. Initially, pwede natin pong ipabite lang yung food. So konting bite, okay na yon. And then after biting, we try to let them either spit it out or drool it out. So pwede po nilang ilabas if they want to, if hindi nila kaya. And then after that, they will bite food. Pag kaya na nila, they can chew it, they can manipulate it in the mouth, and then swallow a little. So hindi natin sila pipilitin to swallow everything, so just swallow a little. And then after that, pag willing na sila to do it, then we can try to challenge them to bite the food, chew it, swallow all, alright? Or pwede din na inom sila ng water or anything, juice or anything, para panulak. So some kids do that. They drink because they need to parang itulak yung food because yan, hindi nila ma-tolerate swallowing it alone. Right? Okay. Next. Okay pa po ba tayo?
Okay pa po.
Okay ba? Medyo mabilis ba? So, bilisan po natin and then later discuss natin. Alright? Now we're going to talk about environmental and other external factors that we have to consider. Ano ba yung mga kailangan nating gawin pa before tayo kunyari mag-set up sa bahay? So what I suggest po is to do it like separate from your meal time. Kumbaga, parang snack time. And then do it like your snack time pero yung goal nyo is for him to be able to tolerate yung iba-ibang food. So, ang gagawin niyo po first is to set up the environment during feeding. So, what are you going to do? You designate a specific place for eating. Kung saan po siya gagawin, yung snack time niya. It can be a corner in the room lang. Okay? So, designate po. Yun, pero every time po na mag-introduce kayo ng food sa kanya or during this particular time, snack time, yun lang po yung place kung saan siya kakain. So you set it up na may table na doon, maliit na table, maliit na chair. Okay? So every time pupunta siya doon, then kailangan naka-set up na siya. Then we have to establish also a structure or mealtime routine. Ano po ba dapat yung nasa routine nyo? First, dun sa routine po kasi it's important to prepare them and organize them eh. So, pag may routine, medyo mababawasan yung struggle between sa inyo and sa bata because na-anticipate na nila na this is what is going to happen. So, that is why important ang routine. If you're going to form a routine, first you should have a warm-up time. So, sa warm-up time po, we suggest kami as OT, we suggest na meron siyang sensory play at the start. So, it can be an obstacle course or any sensory activities para ma-prepare yung bata bago yung snack time. Then, there's the transition activity. Ano po ba yung mga transition activity? So, ibig sabihin po nito, yung activity natin related sa food, related sa eating, pwede kunyari na yung gagamitin nating material is sa food, like pwedeng macaroni shells or rice grain or any food type. Or picture na sa puzzle pero may picture ng pagkain. So that's a transition activity already. So this will prepare him or her dun sa snack time talaga. After that, you come to your table kung saan yung specific area na yon with the plate utensils na gagamitin niya. With this po, very specific kami na it has to be the same plate, same utensils, same placemats that he is going to use pag feeding, because you will use this materials as your cues. Parang ang tawag po namin dito cues to eating. So pag nakita niya po yung plate niya, yung placemats, yung spoon, yung fork, he knows already na he's going to start eating already. Okay? And then the next is the eating part. After eating is the clean up. Okay? So ito po yung usual routine na gagawin nyo if you're going to set up a mini feeding session sa bahay. Now, after that, you have to assess the cues for eating also. So this is what I mentioned kanina. Ano ba yung mga cues to eating nyo? I-prepare nyo na siya, yung mga gamit na usual nila yung gagamitin during the eating, yung mga pagkain na i-present nyo sa kanya. So we have to prepare those things. Then you have to take note also yung manner of feeding nyo, yung attitude nyo, and your relationship with your child while you're feeding him. You note the language used. Pag sa SOS po kasi, we're more after the talking about the food. Okay? Pag-uusapan natin yung pagkain, yung properties ng pagkain. For example, yung color ng food, yung taste ng food, yung texture. So those are the things that you're going to focus. Hindi siya parang session to make him eat. It's more about exploring, knowing about the food, playing with the food. Okay? So we're going to use the food actually as like an object. Ganon. So ang goal natin is for him to be able to tolerate it. Alright? So later, mas magiging clear sa inyo po yung way how we're going to do this at home. Next, we have to take note also of the duration of the meal. Consider nyo po na meron pa tayong time to prepare him, di ba? So may sensory play pa yan. So after that, saka pa lang siya mag-snack or kakain. So you have to set na your schedule na mayroong time kayo for sensory play. And then, the presence of distractors during mealtime, you have to make sure na minimize nyo to. So, if, for example, sa bahay, very busy yung sala or like yung living room, then you move dun sa ibang place sa bahay na less yung distractors. Next is the family meal. Alright? You decide, yun nga, if it's going to be a snack time away from, separate from the family meal, or you're going to do it during the family meal. So yan, that's something na you have to, you have to parang pag-isipan, depende dun sa level ng kid nyo. Some kids kasi very low ang level pagdating sa feeding skills, or yung pag-accept niya ng pagkain, sobrang baba. So you have to set a separate time for him. Yung iba naman, willing na sila to take in food, pero hirap pa sila to when you're introducing a new food. So kaya na siguro sa family, during family meal, pero may extra time kayo para pag-usapan yung pagkain, yung properties ng food and all. You have to use, here you have to use the learning plate. So, ibig sabihin, katulad po nung sinabi ko kanina, kung ano yung plate na ginagamit na during your snack time or during your mini session, mini feeding session, same plate po yun na gagamitin niya during family meal time. Ang goal nyo po dito, ma-expose lang siya dun sa same food na kinakain ng pamilya, but not really to make them eat it. So you talk about the properties of the food on their plate, but not really demand him to eat it or finish it. Okay? Eating with a group, this is also possible. So pwede po kunyari yung mini group na or mini snack time niya, if you have mga pamangkin or mga may pinsan siya sa bahay, pwedeng i-join sila together para at least na-encourage siya to eat and then i-copy yung mga pinsan niya or yung mga kalaro niya na while you're doing your snack or having your snack. Next, this is very important. Ano ba yung mga ano ba yung mga myths of feeding na according to SOS approach? So the first one, myth 1, eating is the body's number one priority. So, maraming mommies na nag-worry kasi hindi kumakain yung anak nila because for them, eating should be the number one priority. But in reality, eating is not the number one, it's breathing, okay? And then after that, there's postural stability. Alright? So if these two are compromised, most probably feeding issues mag-a-arise. Kasi number one, if there's postural problem, mahihirapan sila to sit upright. So affected din yung breathing. So nagkakaroon ng negative experience pagdating sa pagkain. So meaning to say, this is the reason why if a kid has like heart issues or heart problems or may breathing respiratory problems, minsan mayroon silang feeding issues or feeding problems because kumbaga ano nila to instinctive for survival. Okay? Next, for postural stability, this is very important kasi nade-develop yung ibang motor milestones when postural stability is not an issue. For example, if he is able to stay upright, magagamit niya ng maayos yung kamay niya for fine motor tasks. For example, paghawak ng pagkain or paghawak ng baso para uminom. Okay? So, this is the importance of stability to feeding. Myth number 2. Eating is instinctive. It's automatic. So actually, it is not. Possible to na sabihin natin na it's instinctive for the first few months of life. Okay? So for the first month of life, it is. But as the kid grows, for example, around 3 to 4 months, yung nagkakaroon na siya ng primitive motor reflexes like nag-rooting or kunyari merong tawag dito may dumampi sa gilid nung pisngi niya, ang tendency ng kid is to move towards it or may sucking, may swallowing. So, critical period is around 4 to 6 months kasi around this time, okay, nadidevelop yung iba't ibang motor skills nila. But after that, after 6 months, yung feeding, yung reflexes na to, yung feeding reflexes, it becomes a learned behavior or a skill. So feeding become a skilled activity already. So aside from that, yung learning, yung from iba't ibang factors from the environment, it affects also as well yung sensory modulation and discrimination. Also, we take into consideration yun na nga yung postural disorder if the kid has postural problem or motor planning issues. Next, myth number 3, eating is easy. For us na walang physical problem, it can be easy, but we have to take note that eating is not easy. It's actually the most complex task. Alright? So, why is it complex? For example, one swallow pa lang, it takes 26 muscles and 6 cranial nerves to work. Alright? And at the same time, this is the only activity na nag-require for us to, for all the systems to work. All the systems meaning to say yung sense of sight, okay, sense of smell, sense of taste, yung touch, even yung two systems natin, the vestibular and probe, okay, those two systems need to work for our kid to be able to stay upright, for him to be able to not fall while eating, no, yung ma-maintain niya yung position niya. So eating is not an easy activity. Myth 4. So myth 4 is eating is a two-step process. So for us, eating is just like kunyari, you sit down and then number 2 step is you eat. It's not like that. So eating actually it involves 25 to 32 steps. So, this is according to the steps to eating. Yung kanina na diniscuss natin from tolerance, from interaction, to smelling, to tasting, to eating. It's made up of 25 to 32 steps. And then, yung pagbibigay natin ng challenge, it moves from distal to proximal. So, it's not just like kakain yung bata ng rice, it will be that easy. So, we have to address it starting from the first, from tolerance, to the last step, which is eating. And it includes about around 32 steps. So this is what I'm talking about. Okay, you see the steps, parang steps sa hagdan. So from the first step, that's tolerance. Then the second step, that's interaction, smelling, touching, tasting. So all of this, kailangan niyang daanan for him to be able to tolerate food better. Myth 5. So, myth 5, it is not okay to play with food. Alright, for us, okay, for those who practice SOS, play is really the way to teach eating. Okay, so with play, we let the child discover food, interact with food. So we let them wear the food or let them, tulad ng picture, no, hinahayaan natin siya na paglaruan yung pagkain, mas okay na parang mafe-feel niya all over his body for him to be able to tolerate it better. So, for example, we let them play it. We use the food para maging play object. So here, we let the food be used for something different, or yung purpose is not just for eating. Pwede, for example, we use it for art or to create other things, or like kunyari as an object for play. So it's messy, yes. It's a play with the purpose actually. So we teach the child about the physics of food. Kunyari before niya kainin, we talk about the properties of the food, the taste, the texture, the color. So those things are yun yung focus natin during SOS. Alright, next. It is not okay to play with food. Eating needs to be learned. So for some kids, it's natural for them to eat. But for some, for yung minority kasi, yung may mga feeding issues, they have to learn it. That's why we have to teach it to them. So we will start from dun sa pinaka-basic, which is i-improve yung comfortability nila sa presence ng pagkain. Here we also encourage them to spit. Okay? So, okay lang na ilabas yung pagkain kung hindi nila kayang i-tolerate or hindi pa sila ready i-swallow. Next, if a child is hungry enough, he or she will eat. They will not starve themselves. Okay? So, some of the parents, nakakakuha sila ng tawag dito, mga advice na if kunyari nagugutom, if yung anak mo hindi kumakain, gutumin mo na lang. Kasi eventually magugutom yan and kakain whatever you present them. This one, for this particular topic, actually true siya for around 94 to 96% of the population. Alright? But for the remaining 4 to 6%, hindi siya applicable. Kasi lalo na if your child has a medical problem or matagal nang meron siyang feeding issues ever since infancy or like toddler years, problema niyo na yung feeding. Minsan, because disrupted na yung system niya, hindi na sila nakaka-feel ng gutom or yung appetite nila becomes suppressed over time. So, even if gutumin niyo sila, hindi nila nafe-feel hindi sila nakaka-feel ng gutom. Alright? So, next myth is number 7. Children only need to eat 3 times a day. So with us, children need to eat approximately every 2.5 to 3 hours during the day. So if you're going to follow this, parang 6 times kakain sila, mayroong snack time in between. So, yun yung recommended. For him to be able to get yung calories, enough calories na kailangan niya for proper growth and development. Okay? So, here we don't suggest na mag-graze sila. So, grazing is actually yung letting them eat parang less than 2 to 2.5 hours. So, sunod-sunod naman. We don't suggest that one. So, yung interval really, yung recommended is around 2.5 to 3 hours interval ng pagkain. Myth 8, it is either a behavioral or an organic problem. So here we have to take note, no, if a kid has a physical problem or yung feeding issues niya is due to physical issue or meron siya, for example, sensory issues, minsan they develop a set of behaviors already to avoid the task. Okay? So yung set of behavior na to, nai-interpret natin as a behavioral problem. Pero in reality kasi, may underlying reason why siya nagre-respond like that. Kunyari, nagwawala, nag-iiyak, there's a reason why. Most of the time, may underlying reason why he reacts that way. So that one, yun yung kailangan nating malaman. Next, there's certain food are only to be eaten at certain times of the day, and only certain food are considered healthy for you. So this myth 9, actually, for SOS, there's no breakfast food, there's no lunch food, okay? Lahat, we take food is just food, okay? So here also, we focus in the property ng pagkain. And we have to take note also of the food groups, the protein, carbo, and the fruit and the veggies. Malaki din yung part na piniplay ng junk food during SOS. Kasi during the initial phase, junk food yung ginagamit namin to introduce food. Kasi sila yung visually appealing, sila yung nag-o-offer ng maraming texture, sila yung mas madaling i-manipulate. And then maraming pwede kang gawin actually, like for food art, marami kang options how to use it. So example is the one in the picture. So here, very pleasing to the eye. So even if hindi kinakain ng mga anak natin, they're willing to hold it or manipulate it. Kasi mukhang safe siyang tingnan than the regular table food. Next, myth number 10. Meal times are a proper special occasion. So if this is what your family is practicing, I suggest talaga na you set a different time of the day where you will practice the kid for feeding or for SOS. If you're going to follow SOS. Kasi yun nga, the kid are encouraged to play with food, to use it, okay, as an object for play, to manipulate it, to use it as like an object for, kunyari, like the one that I showed you, yung picture ng baby na pinispread niya sa body niya yung spaghetti. So if you are very particular about cleanliness, ganyan, so I think pag ganito na, pag SOS or pag yung time you with your kid and you want to work on his feeding behavior or feeding problem, then I think we have to skip those parts. Okay, medyo i-let go muna natin pagdating dito sa pag-address ng issue kasi we need that particular activity para mas maging comfortable yung bata with food. Now, we will talk about the common problems during feeding. So, ano ba yung mga common problems natin? Yung first is yung struggle Okay, struggle during mealtime or force feeding. With SOS, we don't recommend force feeding actually. So kasi ang nangyayari with force feeding, nagkakaroon ng negative experience yung bata. So if there's a negative experience, tulad ng paulit-ulit kong sinasabi, it will affect yung behavior ng bata towards food. So this is a big no-no. Also, we don't recommend, for example, yung i-trick natin yung bata to eat by covering yung pagkain na gusto nilang kainin dun sa loob, or like may nakataklob yung rice dun sa ulam, like that, because kumakain lang siya ng rice pero hindi yung ulam. So we don't recommend that kasi the next time around you try to make him eat the food, medyo magdadalawang isip na siya to eat it because she's going to think, dinadaya ba ako or may food ba sa loob, or ito ba something that So those things you have to establish kasi the trust. Again, yung goal mo is to re-establish the trust and to make the kid feel comfortable during feeding. So this is really the goal of SOS. Kailangan natin parang mas restructure yung tingin ng bata towards food and towards pagkain, lalo na if yung problem dahil sa past experience or yan nga medical condition or sensory processing issue. So kailangan nating ma-feel niya na okay lang for him to try or to taste the food. Also, we will talk about food jags. So, ano ba yung food jags? Food jags is yung paulit-ulit nga na pagkain ng isang type. For example, hotdog lang, or chicken ng Jollibee or McDo lang, not other chicken, or pwedeng any type of chicken pero fried chicken lang. So, those are food jags. It leads to restrictions or limited variety, very rigid diet. Okay? So, limited lang kung ano yung kinakain niya. Kids can be very specific with mealtime preference. Ang problem here is possible or at risk sila na ma-burn out. So, ibig sabihin, if yung nagpo-food jog siya ng chicken, if mawala ito, ma-burn out siya sa chicken, at hindi na bumalik because he's a problem feeder, dun kayo mahihirapan because you don't have other option. That's why we don't recommend to let your child eat a particular food ng paulit-ulit because possible siyang ma-burn out. And if that's the only one, like for example, a very limited na nga and then paulit-ulit pa at na-burn out siya, wala na kayong ibang option to feed him. Okay? Next, how can we prevent food jag? So what you do is to offer that food only every other day. Okay? So, isip po kayo, ano po ba yung iba pang pagkain na kinakain niya. So, pag may iba pa kayong option, then you try to alternate it. Or, try nyong schedule yung pagbibigay ng food na kinakain niya. So, again, important strategies is to make it a good learning experience. So during your feeding, you try to teach your kid. You can incorporate a lot of things already. So yung mga concepts, for example, the color, counting, okay? So you can incorporate those things, yung textures, even like kunyari yung concept ng soft and hard, for example, ng kunyari wet and dry. So those things, you can incorporate it during your feeding session. So make it a good learning experience. You can also use reinforcements. So it can be positive reinforcements like yung mga verbal phrases, or it can be like activity privileges. Okay, so you can use those things just to encourage them to eat more. You can structure the mealtime at home. Don't forget this. So, i-try nyo na structure siya in such a way na you set a particular place in the house, okay? And then use a particular set of utensils. And then, don't forget the learning plates. So, isa lang yung plate na gagamitin niya even during family meal time. It's the same thing. And then don't forget the cleanup routine. Sa cleanup routine, you have to encourage your kid to be part of it. During the clinic po kasi, during sa feeding session sa clinic, malaking bagay po yung cleanup routine sa amin. Kasi for those kids na hindi nila tolerate even holding or like hawakan lang yung food, pero during the cleanup time, kaya nilang hawakan because they know it's the end. Very excited na sila to end. So, gagawin nila whatever you ask them to do. So, for example, during cleanup time, we ask them to, kunyari, pick up all yung mga leftovers, ganyan, to put it in like a particular bowl. So, yung particular bowl na yon, doon namin ilalagay yung mga food na na-spit out nila or yung food during leftover food during cleanup. So, using their hands, pwedeng gamitin nila yon to pick up. Or if hindi pa kaya, you try to lower the demand using, kunyari, a spoon to scoop it out and then throw it din sa spit bowl. Or if possible naman, if kaya naman nila, you can encourage them to, for example, put the food between the lips and then blow it inside the spit bowl. So, depende po sa level na kaya nang gawin nung bata. So, if they can spit it out, spit it out. Sometimes, if we know that they can swallow it or eat it, we try, during the cleaning up time, we try to encourage them to taste a little or bite a little and then swallow some and then throw the rest. So, depende po kung anong level na nung bata. Next, yung example po ng goals namin for SOS, for example, is at least 30 different food consistently na tinatanggap niya. So, ibig sabihin po, yung willingness niya to accept food, new food, and then sa steps to eating, andun na siya sa taste step, 80 to 90% if presented with new food. So, kumbaga, willing siya to taste. It doesn't mean na kailangan niyang kainin. It's just that willing siya to taste it. And then, if not, okay lang. So, malaking bagay po kasi yung taste step. Kasi here, if they're willing to taste it, kung nagustuhan nila, then they're going to eat it. So, possible na magkaroon tayo, madagdagan yung variety ng food na ina-accept nila because nung natikman nila, nagustuhan nila yung lasa. But if, for example, hindi siya willing to taste it, mahihirapan tayo to make him eat. So, this part, the taste step, is very important. Next is yung decreased struggles during mealtime. So, kumbaga, wala nang pilitan, wala nang iyakan. During mealtime, willing na siya to taste without struggle. Then, we know na parang yung goals mo for feeding, unti-unti nyo nang na-achieve. As you can see, hindi siya very specific sa isang pagkain lang. Like, kunyari, rice lang, or like this particular food lang. So, this one is more of the general behavior ng bata towards food. That's what we want to improve. So, things to note. Also, you have to note the length of your feeding session. You have to set it up. Remember, you have the time pa to do preparatory tasks, the sensory play, before the eating or the snack time itself. Next, what are the other areas that need to be addressed? So you have to take note of this also. So baka may mga ibang issues pa, like may sensory issues, may motor planning issues, may gross motor or fine motor delays. So you have to address those things as well. And then, where do you start? So, saan ba kayo magsisimula? Do you start like setting up, for example, a separate snack time? Or do you do it during your family meal time? Baka kaya naman na during family meal time, you just have to set time, like kunyari, focus more on the food, ganyan. Or kailangan niya ng hiwalay na snack time to focus on that. Next, also you think about, do you start nga with food or food play? So, it's the same thing. Pwede na ba siyang mag-start dun sa food na kinakain ng family or kailangan pa ng gamitin yung food as play tool, or do you need time to play with food pa? Alright. Okay pa po ba tayo?
Okay pa po.
Sorry. Malapit na tayong matapos.
Okay lang po.
Sorry Pero konti na lang. Konting push na lang. Alright. So, 3 factors affecting your child's participation in feeding. So, it can be coordination problem of motor and sensory skills. So, these two kasi works hand in hand. So, most of the time, pag may motor issues, merong sensory issues din. So, if mayroon siyang problem with one or one of these areas, most probably, magkakaroon din ng problem in feeding. Then, cognitive and behavioral skills. So, with behavioral, again, we'll ask, is the child able to attend to tasks? How long is he able to attend to feeding? Can he concentrate, focus on the food? Or kailangan nyo pang bigyan siya ng screen or like iPad or panuorin sa cellphone while feeding para distracted siya. So, those things are some things that you need to take note. Okay, or like kunyari, hindi siya mapakali, hindi siya mapaupo, kailangan niyang gumagalaw or tumatakbo, tapos hahabulin niyo during feeding. So ano ba siya, how is he during feeding? So those things. And then parent emotional state. So if the parent is really frustrated na siya, hindi na kumakain yung anak niya, nag-worry na siya about his health, then I suggest na for parents naman, you look for a support group. Okay? So this is a good way for that. At least here sa group natin, you have somebody to ask. Okay? So the other parents will empower you, will give you parang suggestions, will motivate you to continue. Even those times, even if yung mga times na parang you feel parang hopeless na. Okay? So this is a good way. You being part of this group is a good decision. Next, environmental consideration. Okay, you have to adjust yung variables to match yung child's sensory processing system. Okay, so what I mean is, you modify the environment. If, for example, you think madali siyang ma-distract, you cut down distractions. You choose a place in the house na walang masyadong tao, okay? A room na pwede kayong mag-focus sa pagkain. Kasi the more distractions, the more siya hindi makaka-focus, mas mahihirapan kayo. Next, you provide heavy work activities like what I've said prior to going to prior to feeding. Okay, so heavy work activities works to calm them down. Increase yung environmental cues to transition into meals. So environmental cues are yung mga cues to feeding. Yun yung kanina pinag-usapan natin, like yung particular place in the house, yung set of utensils, yung mga usual niyang ginagamit. Okay, so that are your cues to feeding. Next, ensure that your positioning are appropriate and for optimizing and maintaining arousal level. So make sure na tama yung height ng chair sa table, so he is able to sit upright, hindi siya nakaslouch, okay? So those things, very simple lang, pero you have to take note of everything. Okay, yung mga simpleng bagay, because it will affect the behavior of the kid during feeding. Then watch the portion size on the plate. Okay? Make sure na hindi overwhelming yung nakalagay sa plate niya. Alright? So, as much as possible, you don't want the kid to be like discouraged just because ang daming nakalagay sa na pagkain sa plate. If you think, kunyari, pakonti-konti muna. And then you try to see if pwede nyo siyang i-challenge. Kasi pag kulang naman, you can put some more. But if it's too much on the plate, then lalo siyang aayaw. You watch for visual overload of things on the table. This is one more thing. If you're going to do SOS, as much as possible, you present the food one at a time. Hindi nakakalat lahat yung pagkain on the table and then uupo siya with yung plates pa niya, yung gamit pa niya, and then lahat ng food nasa table. So, make sure na meron kayong isang area or pwedeng basket na nandun lahat ng pagkain. What we do also in the clinic, we don't parang show them kung saan nakalagay. Like yung we're using snacks, and then nasa lalagyan pa sila, and then pinapakita namin ino-open yung snacks. We don't do that. So we prepare ahead of time, nilalagay na namin sa mga containers, for example, yung mga snacks na gagamitin namin, para hindi nila ma-associate yung lagayan dun sa ipapakita namin na or ipapagamitin naming food during the feeding. Okay? And then, putting it all together again, you prepare for the activity. How do you prepare? You give movement or sensory play. Okay, here, you address motor planning na. You increase the proprioception already, and then you provide heavy work. When all of these are complete, during your snack time, the result is yung kid is able to stay seated and engaged. Okay? Improve yung ability nila to use the utensils because of the increased tactile and proprioceptive input during prep time. Yung positioning nila mas better, yung sitting nila mas matagal, and then yung acceptance ng food mas better then because they're well organized. So that's why we do preparation. We give movement or sensory play before the real snack or meal time. Okay. These are the things that you can do if your kid has motor planning issues. You can incorporate sensory motor activities prior to snack time. Give solid meltables. Okay? Solid meltables are like snacks na solid sila pag nasa labas and then nagme-melt when nababasa ng laway. Okay? Such as puffs, Marie biscuits, yan. So, honey stars, yung madaling ma-manipulate inside the mouth because for kids with motor planning issues, very safe ito. Hindi sila at risk na ma-choke or ma-aspirate because of the food kasi hirap sila to manipulate. Here kasi nami-melt na siya in the mouth. So mas madali na nilang maswallow. So another thing that you can do, you place the food laterally. Kumbaga nasa gilid na siya para diretso na siyang magbabite. So that's one way you can do it. So dun sa gilid, pagka bigay nyo, ibabite niya na. So, parang kumbaga, na-minimize niyo yung gagawin niya. So, instead of i-manipulate pa niya yung food from the middle going to the gilid ng mouth niya, nilagay niyo na sa gilid para i-chew at i-swallow na lang niya. So, kumbaga, mas easier for him. When he's able to do that, then you challenge him na parang kailangan niya nang i-manipulate yung food. So, from the middle, kailangan i-move sideways and then chew and then swallow. So, let your child use their finger to move the food in the mouth. When you see your child putting the finger in the mouth, kasi nahihirapan siyang i-manipulate it using just his tongue or the muscles, you let him at first. Kasi yun yung way nila para mag-adjust. Hindi kasi nila plano how to manipulate the food eh. So, what they use is the hand, their fingers. So you let them do it, but when their motor planning improves, then you challenge them not to use their fingers anymore. So again, another thing is you thickened the liquid. So pag thickened yung liquid kasi, di ba, like kunyari shake or yung mga yung ganung consistency, pag ininom nila, yung mas yung proprioceptive input na receive nila is mas increased yon o mas madami. Lalo na if, for example, you let them use a straw na mataba, so kailangan nilang mag-suck ng mas malakas. Even yung mga straw na mga curly-curly, yung medyo iba-iba ang design. So bago pa makarating dun sa tip kunyari yung shake, so yung sucking nila na kailangang gawin is mas kailangan nilang mag-exert ng effort. So that's proprioceptive input already and it helps with motor planning. You do silly face games. So pwede yun na parang you ask them to copy yung mga facial expressions nyo. So that helps with motor planning. Okay? Because they need to imitate. Next. What can you do if inadequate yung proprioceptive processing? Yan, incorporate yun nga, grading ng texture. You give yung chewy or crunchy food, mas better for them yan. So, again, also manual vibration sa chin. So, you can do fast tapping. Itatap nyo lang yung chin. That's to provide vibration. Utilize the bite and the pull. So you ask them to, kunyari, something hard, like a pretzel na matigas, ask them to bite and then pull it. So that will provide additional proof input to them. Limit overstuffing. So pag yung parang pinupuno nila yung mouth nila. Okay? So what you can do here is you provide lang yung small amount of food para hindi sila nag-stuff ng food in the mouth. Alright? They do it kasi parang that it provides proprioceptive input. Lalo na if they're seeking. Okay? Sensory seeking, they do it. So what you do is to limit the amount. Next. If inadequate yung tactile discrimination, so you use textured utensils, iba-ibang texture, chewy tools. That one kasi parang pag sa chewy tools, kailangan nyo na ng OT for that. Intense flavor, you can use that, sour or spicy. Chewy and crunchy food, alternating with softer food. And then more refined tongue movement or face movement. Also, we recommend dab-dab to clean the face. So here, pag dab-dab, it's more of parang idadab nyo lang, but not really wiping. Kasi some kids, they find it, they cannot tolerate the wiping sensation. Next, the use of the mirror, and then the whistles, the straws and bubbles, and weighted utensils and cups. Vestibular processing, for vestibular processing that are inadequate, you have to make sure that stable yung seating nila. Okay? To make sure na hindi sila matatakot to fall. Okay? They have to have proper table and chair height. Then you work towards using a bench when you want to challenge them. Kasi yung bench wala ng back support. So you can challenge them to parang balance while they're sitting. Next, excessive use of proprioception. You just give heavy work activities such as rolling over, jumping, wheelbarrow walk. Okay, you take breaks, and then give heavy work. Tactile defensiveness. You go slow, you don't force. Alright? So this is very important. Let us gradually nyo introduce yung input sa kanya. Read their cues. So titignan nyo yung reactions niya. If they can tolerate, move up. If they cannot, you stop. Next, incorporate deep pressure. Work distal to proximal again. Okay, and we're done. Thank you for listening.